Hey everybody, welcome back to this edition of the Technologist Repair Shop. We're going to look at images that have been taken in our clinics, and we're going to look at them and see what needs to be done to make them a little more diagnostic. And I'm hoping you guys are finding this helpful on what you need to see on certain x-rays and what's passable and what isn't. So we're going to go from nope to dope. So let's get started. Just so you know, I'm going to try and shorten these up a little bit. So we're only going to do 2 or 3 images per edition, just to keep them a little bit shorter. They've been running a little bit long. So here we go. So here we have a chest x-ray. Okay. There's a few things going on with this x-ray. Well, first of all, we've got bra straps in the lung fields, which is, what we're trying to avoid. Unless the patient has a bra that's just a slip over bra, there's going to be clasp in the back. There's going to be clasp on the shoulder straps, and a lot of times an underwire. So it's important that we take the bra off for any chest x-ray, unless it's a slip-on sports type bra. Usually we can get away with that. So looking at this, it looks like our collimation is pretty open, which you do open it quite a bit for a chest x-ray. You'll note that the patient does have large breasts. One thing I'm wondering, looks like the patient's arms are up in the air. I'm not sure why we would do that. It's more comfortable for the patient if they can put the arms down to their side. But nonetheless, it did accomplish getting the scapulas out of the way. So in that case, that's good. But most of the time, we're going to have the patient's arms down to their side, and we're going to rotate or roll their shoulders forward to get the scapula out of the lung field. We're a little bit underexposed here. You can see the graininess throughout our entire chest cavity. So it's a little bit light. I would at least double, probably triple the mass on this person, and maybe get a little bit better picture out of it. Another thing, there isn't a marker, and it's kind of hard to tell which side is which with this chest x-ray. The volume of air in the lungs is pretty low, so we really can't see a lot of the lung tissue. But we've got a whole big old mess going here. So it's hard to tell which side's right and which one's left. Let's look at the good picture real quick. So you'll note that the trachea comes down and bifurcates right here underneath the aortic arch right here. And it's kind of off to the right side. So and the aortic arch is off to the left side. So if we look at this picture, the trachea is coming down, and normally it's off to the right side. So I would say that this image is flipped, because our aortic arch is probably right there. It's kind of hard to see along the left side of the trachea. So I'm guessing that this over here is the left side, and that image should be flipped. Okay, always try to use a marker, so when something like this comes up on our screen, we know which side is left and which side is right. But you always can look at the trachea compared to the aortic arch. Just know that the aortic arch is on the left, trachea is going to be on the right side of that. So we know that this is the right side, even though we can't see the aortic arch really well. Okay, so make this image better, we're gonna center a little bit higher. We want to include the apices of the lungs, which have been cut off right here, and we want to hit them hard enough. If the patient's a large patient with large breasts, we're gonna have to hit them fairly hard. Okay, and if it comes out grainy like this, you're gonna have to retake it to get a little bit better picture. And on this one, take a deep breath in, blow it all the way out. Another big breath in and hold it. We want to maximize the air inside the lungs themselves, so we can see more of what's going on. And use a marker, take the bra off, and collimate a little bit tighter. We'd be good to go. So here's the dope version of the chest x-ray. Okay, you'll note that the patient probably has a necklace in their mouth. We can just see a little piece of that, but it's not in the anatomy anywhere. It's marked with a left marker. We can see both lungs fully inflated all the way from the apices down to the angles down here. Okay, and you'll note the trachea coming down and bifurcating into the lungs. The aortic arch coming up on the left side, trachea on the right. Okay, good contrast. It's a nice looking picture. It's beautiful. You'll note that the patient's arms are down and the shoulders are rolled forward, because we can see an inner scapula right there, and the other one is right here behind the ribs. So the scapula are actually out of the rib field, or out of the lung field. So yeah, very good picture. This is what you want to be seeing versus this. Okay. And you know, if a picture comes up and you have taken that image, this is nothing against you. Okay, this is just so we can all learn and know what we need to see on these x-rays. Okay, so let's move on to the lateral. I believe this is the same patient. The only big problem with this, you know, laterality is pretty good. We can see that the ribs are stacked on top of each other. There's no big loops out here. Usually when you have big loops of the ribs on a lateral chest x-ray, it's because you're rotated. But the laterality is really good. It's rotated almost perfectly. You know, we can see the profile of the scapula right there. The only issue with this picture is there's no marker. Okay, there should be an L marker right here, and it's really grainy. It's really underexposed. So, you know, if you take this picture first and it comes up and you can see the graininess, you're going to retake that picture. You're going to bring your mass up at least by half, probably then again, and get your good picture. And then when you go over to the lateral, you're going to have to bring the mass up just a little bit if you're good on your PA. So, but yeah, this was shot a little bit too light, not enough energy to get through that body part. So I would redo this one. I would probably triple or quadruple my mass and shoot it again. Okay, the lateral is really good. Collimation's fairly good. We're open a little bit on the front, but that's okay. Anyway, let's look at the dope version of the lateral chest x-ray. This is a very nice chest x-ray. It's the same patient as our PA right here. You'll note that the necklace is up in the mouth and out of the way. Got a really nice look at the lateral sternum all the way down here. And we're able to see the heart in profile right here. You can see the aorta coming just anterior to the right there. And you'll note that the ribs are stacked on top of each other. There's no big loops coming out here anywhere. You know, we can see both angles barely, but we can see them right there. So this is a nice lateral chest x-ray. So we went from this, where you can't really see the lung field at all just because it's underexposed, to a very, very nicely exposed chest x-ray. And obviously this is a male, a little bit skinnier. When they get bigger or have big breasts or anything like that, it can be challenging. You just need to make sure that your technique game is on track, and we don't use automatic exposure control, so we're going to have to put the technique in there manually. Just know that if it comes out light, you double your mass, usually sometimes quadruple your mass, and that's gonna give you a better image. Okay, nice lateral chest x-ray right there. Okay, let's look at a pelvis. Okay, this is an AP pelvis. Couple things. You know, it's probably collimated a little bit too much, just because we're cutting off the greater trochanter on the left side over here. So that could be open more to include both greater trochanters of the femur. There's also a marker right in the middle of the anatomy, so that marker needs to be over here off to the side. And this is obviously a bigger patient, but I found that even with the big patients, you can still fit a whole pelvis on one image if you pay really close attention to your positioning. We just want to make sure that we get both iliac crests up here, which they have been cut off on this one, and our centering point is a little bit off. Okay, we need to be centered up here a little bit higher, just so we can include the crests up here. And with pelvises, it's always easy to you can usually fill the ACES and then follow it up along the top of the iliac crest, and make sure that your image is going to catch that. Make sure you have light up there. Just remember, wherever that light is where you're going to expose. Okay. But we've done a good job on flaring. I mean, we could flare out these hips out a little bit more by turning the toes in. So we're seeing a little bit of, or we're seeing the lesser trochanter probably more than we need to see. Looking at this one, you'll note that we can just see the lesser trochanter peeking out right there, and our greater trochanter is out there in perfect profile. Okay, that's because the toes have been turned in, and it flares those greater trochanters out. Okay, but yeah, if we take this picture, this is what comes up. We're definitely going to be redoing it, just because you want to include the entire bony pelvis, all the way from the crest all the way down as far as you can get down on the femur. Okay, make sure that both greater trochanters are seen. So a little bit grainy picture. We could probably double our mass on this one and get a little bit cleaner picture as well. So let's move on to the dope section of the pelvis. This is the beautiful pelvis. Really, really nice. The entire bony pelvis is demonstrated, and we've got a good look at both SI joints right here. Okay, and like I said before, our greater trochanters are flared out, so we can see those extremely well. The lesser trochanter is basically superimposed by the superior femur right here. I mean, we got a little bit peeking out right here and a little bit peeking out right here, which is really great pictures. Okay, it's a really, really nice picture of the pelvis, and this is what you want to be seeing. Just make sure that entire bony pelvis is there. It's marked. Contrast is perfect. We've got good differentiation between soft tissue and bone. We've got some bowel gas coming through here. The sacrum is well developed and well seen. So very, very nice pelvis. So we went from this, not being able to see the entire bony pelvis and the marker in the way, and our femur's not totally, our greater trochanter's not totally flared out. We want to superimpose those lesser trochanters right here, right? But this is what we want to see right there. Okay, and that's done by really paying attention to your positioning. Make sure that you're going to catch that upper iliac crest in the picture, and the entire bony pelvis plus the femurs with their greater trochanters flared out on the image. This is what you want to see. Okay. Okay, well, I hope this was helpful. Like I said, I'm going to try and keep these a little bit shorter, but I want you guys to start seeing what needs to be on the image when you take it, and if it's not there, take that image again and pay really close attention to your positioning as well as your techniques. If it's grainy, really light, poor contrast, you need to bring your mass up. Okay, at the very least, you need to double your mass to see an optical difference on the image. It's an art, and just make sure you're using your markers, and as you go, you're going to learn more and more on what needs to be seen on the image. You're going to get to where you're not taking this and taking this, okay, and having fewer times of having this come up and having this come up instead. Okay, just work at it, study the images. You go through my critique videos and you'll see exactly what you need to see on every image that we take. Anyway, I appreciate you guys stopping by today and listening to this. I'm sorry I didn't get one out last week, but going forward we'll do one a week, okay? And as always, if you have any questions, please don't hesitate to give me a call, and I'll help you through whatever you're doing, okay? Keep working hard. You guys are doing great. I was on a phone call with a radiology guy up in Alaska, or a girl. It wasn't a guy, it was a girl. She was very nice. And we were talking about some training things for their people. And, that's the one thing that I've been most proud about doing this work is when I go through the images, I'm seeing better and better images, guys. So great job. I looked at a couple this morning. I was very impressed. Very, very good job. And keep working hard. I know it's tough to find time to watch these videos, but they will be helpful if you'll let them. So anyway, we'll see you next week. You guys have a great weekend. And, well, I guess it is Monday. So have a great week and then a great weekend. And we'll talk to you next week. Okay, see ya.